Voice clear? Any issues? Okay, anyway, very good morning. We'll start? Yeah. See, probably this is our last remedy, and it's been a very pending remedy. We thought of spending quality time on this particular remedy. That's how the delay. I'll just start with a case, a very interesting case. Please try to concentrate on the case that will be short. And once you understand the case, we'll slowly enter the remedy that we are going to discuss. Okay. You are a third year student. So, what could be the probable spot diagnosis? Meaning, just looking at this. Very good. Okay. Anything else that you can think of apart from bed sores? Okay. The other name for bed sores is decubitus ulcer. Very good. Anything else? I'm happy with your third year surgery knowledge. Absolutely right. It is a case of decubitus ulcer. It's a case of decubitus ulcer. So I'll just give you a small background. What exactly happened is, see, she is a lady, age some 60 plus, and she is bedridden. Her left side is paralyzed. Okay, left hemiplegia, and she is bedridden. Okay, and you know the reason why she has got bed sores, or what we also call it as pressure ulcers. So she is bedridden. Okay, and that's how she landed up with bed sore, and she was on allopathic medication for quite some time, almost some 2.5 months she was on allopathic medication. She was given ointments and she was given antibiotics and their line of treatment. Unfortunately, she did not improve. That's when the husband had consulted me, asking if we can do anything in homeopathy. Okay, that is the small background. And she was, yeah, I just gave you the, see, the bed sore was quite deep. You can see the image. If you just see, it's deep enough, and it measured around 3 inches and 2 inches, and depth was almost 1 inch. This was the measurement given. Now, when you get such cases, where you don't get to see the patient, okay, patient is bedridden, now you are in a position to visit the house. So we have to entirely believe, trust on what the husband is giving us the information. So how do you go about? It's a small question. How do you go about when you get such cases? Quick. How do you go about in such cases? Huh? What is it? Okay, very good. You asked for the history. How did it start? And I've given you the history. She is bedridden, a case of hemiplegia. Okay, and the result is bed sores. Good. You asked the history. I've given you the history. Beyond history. Yeah, you look at the ulcer. Very good. You look at the local ulcer. How is the ulcer looking? Good. Possible. You look for, okay, whether it is healing or non-healing. From the information you got, it is non-healing. So you look for the ulcer. It's a very nice point, valid point. The husband had got the picture. I had asked him to give me a picture. So we did see the picture. And beyond that, okay, good. You also try to understand if she has got diabetes, if she has got hypertension, or if she has got any other issues. Good. Okay. Okay. Mentals of the patient before she got this particular thing. Fine. How does she feel now? Beautiful. Good. I'm happy with your questions. Good. Keep it up.
Does she complain of pain in the picture?
Okay. Does she complain of pain? Okay. Chalo. Good.
How is it on lying on bed and not?
How is it on?
Lying on the bed.
Uh-huh.
Does it create or anything?
Okay, yeah. So does it? She is bedridden. Okay. How is it? Yeah, okay, she's got pain. Okay, fine. So when are the, if at all you are getting any aggravating factors, modalities, okay, good, fair. See, for a third year student, your line of questioning is very, very valid. Good, keep it up. See, simple thing I had asked is, the husband told the discharges are very offensive, and the other very important thing the lady told is, God, why don't you take me away? Okay? God, why don't you take me away? It's better I die rather than living like this. Please read this statement. It's better I die rather than living like this. I can't live with pain. I can't live with suffering. God, please take me away. This is the English translation of the local language the husband had used. She keeps telling this many times. Please take me away. Okay? As a third year student, I don't know if you are lucky or if I am lucky, we got remedies having similar situation. If you remember, the remedy, we spoke of creosote, a very old man who had eruptions over fingertips. We had given him creosote. Good. The rubric we took was death desires from despair. Beautiful. And second, we spoke of a carbon. Very good. A carbon petroleum where the patient was in a hurry to settle things. He was writing the will. I am not going to live long. Death presentiment of, and is in a hurry to settle things. I shared 3 or 4 cases where we had prescribed petroleum and beautifully the lady improves. Here we are into a different situation. That's why I am trying to tell you that we are a little lucky that we get to learn 3 remedies. Having death desire, fine. Now can we think of creosote here? Or can we think of petroleum here? No. Now what is the situation? What should be your next question? Why this lady does not want to live? Okay? Why she is invoking death? Why she wants God to take her away? Fine? So the answer she gave was, she already has hemiplegia, paralysis agida, she is not able to move, and on top of it she has got a huge bed sore, and she has got pain, she has got suffering. So this is the situation she gives. Okay, we will go ahead. Please capture this image, it's very important. This was the first image. Before we started with any homeopathic medicine, this is how the decubitus ulcer was looking. Okay? And slowly, can you see any difference? If you have to appreciate the difference, you should remember this. Anyway, I'll come back to it a little later. Now this was the second image. After 15 days and after 1 month, can you see some difference? What is the difference that you are seeing? I'll come back 1 second. So this is the image that the husband got after a month. Okay? And this is the fourth image. You're liking it? Okay. These are all the different stages after our remedy. What exactly happened? I mean, see, my duty as a teacher is only to motivate you. Done? Okay. So when you give a right homeopathic medicine, I always keep telling, when you give a right homeopathic medicine, you see wonders. Okay. So, what was the remedy given? What were the rubrics we took? Will be a little suspense. Okay, remedy though you will get to know. And remedy, it is not creosote. Remedy, it is not petroleum. Here also the lady wants death. But why she wants death is very, very important. Okay. So we'll quickly look at a beautiful remedy. Sepia. Beautiful remedy. I mean, I've been waiting to teach this particular remedy, Sepia. Now, a beautiful way of understanding materia medica is understanding the creature itself. Okay. Are you getting my point? Should I repeat? One beautiful way of understanding materia medica is understanding the creature itself. Okay. So when you Google, when you go back to Wikipedia, when you Google search Sepia, you have pages of information about Sepia. Okay. And I have taken few from Google, which for us as a homeopath, it will be very, very useful. Okay. So can you see this image? Done. Okay. I have few more images. I'll just try to show you so that you will have a better understanding. Yeah. Okay. So you have few more images. Just have a look. This is also another image of Sepia. Okay. And this is the other image. This is the mating of Sepia, and we'll again come back. There is a beautiful thing you have in the eye of Sepia, and this is another view. So now very important is one second. Can you see this here? What is it that you can see here? Huh? It is sand. The sea bed. And can you see a creature? Yes? If your vision is sharp and if your vision is acute, you see something. And what is that? This is the creature. So Sepia as a creature has a beautiful character where it can camouflage. What is the meaning of camouflage? Changing colors. Okay. Now why they change color is again very, very interesting. Okay. So we will come back to our presentation. Okay. Now, why Sepia camouflage? Okay. So it is a protective mechanism. Okay. For example, when some creature, some fish is trying to attack, it's a sea creature. Okay. So when another fish or when something big is trying to attack, it will change into the color of the environment. So the other fish, if it is Barretta, if the fish is Barretta, the other fish which is trying to attack Sepia, it will be surprised. I saw something here and there's nothing. And that Barretta fish will go back. If the fish is something which is as equally as manipulative as Sepia, it might still catch it. Hey, I know you are here. Right? Because I am a bigger manipulator than you. I know. Right? So this is one of the nature's protective mechanism. And as a third year student, you would have read this story. What made Dr. Hahnemann prove Sepia? One of his painter friend, the secretions, it was used for painting. The ink, it was used for painting. So this gentleman used to paint and used to always keep his brush, to wet with saliva or something, and he lands up with some symptoms. That was the clue Dr. Hahnemann gets. Sepia has some medicinal property, and he will try to investigate more about this fish Sepia, and he starts proving Sepia. Okay. So what I want you to understand from the information that I have taken from Google is, as a homeo student, as a materia student, this information you have to apply into our drug picture. Okay. So what is that information you have? Okay. See, they have got something called as chromatophores. Okay. And they also have something called as leucophores, iridophores. So these structures function to camouflage this species to its variable surrounding. Generally, however, sepia has mottled black or brown color. See, this is the original color of the sepia fish, the cuttlefish. But as per the situation, as per the need, it can change its color. It can change its body texture. This is what you try to understand a little later. See, I'll just not typically read the PPT text, but what you have to understand is the mating of the sepia fish is again something that is very, very important. I mean, this is something universal. When you have to attract a female, men, they have to do a lot of, lot of tricks. They have to do a lot of things to attract a female. Same applies to sepia. Sepia female, okay, if she wants to have, the process of mating, it gives some indication. The camouflage property gives some indication which says to the opposite sex that I am ready for mating. This is an indication that the female gives. When she gives this indication, there are so many sepia men, sepia cuttlefish which are male. So they all want to, take a chance. So to win the sepia female heart, they do a lot of tricks. I mean, you girls would have experienced this process. So they do some kind of a trick, some kind of a thing, and the sepia female will decide whom to mate with. Okay. See, mating here is, what they do is, they have got tentacles. If you just see this, see, they have got tentacles. So it removes the sperm, the male sepia fish, and it will place it in the female sepia fish. This is the mating process. Okay. Then, and I don't exactly remember, male and female, if you have to distinguish, male, I was told, has 2 pairs of extra tentacles. Assume, don't worry about the number, please Google. Assume if female has 3 pairs of the tentacles, male will have 8 pairs of the tentacles. Okay. Then this is how you differentiate. So when a big female sepia male is trying to get intimate with the female sepia, okay, there are many more small sepia boys, small ones, they want to take a chance. So what they do, they put 2 tentacles inside. You're getting my point? So when they put 2 more tentacles inside, what do you assume? It's a female. So it will act as if it's like a female. It will camouflage itself. It will change the color like a female, and very cunningly it will go to the female and it will place its sperm. Are you getting the situation? See, you are all laughing and you are enjoying. What is the tough part? What is the tough part? How do you're beautiful. How do you convert all this into rubrics? Now what is it I am indirectly trying to tell you? Doctrine of signature. Okay? From the external appearance, from the characters of the sepia fish, we are trying to understand few things. And you will be surprised to see all these things in the proving. After proving, we are trying to link. But what is the story you have understood? What is the story? Male fish, female fish, sepia, cuttlefish. So one female cuttlefish, it will change its texture, telling I am ready for mating, fine, and it will give an indication to all sepia male fish. So sepia male fish, they also do a lot of dancing, they also try to impress the female sepia, and they try to keep their sperm into the female thing. Okay. Now, when you have big sepia fish, small fish also want to introduce their sperms into the female. So what do? They camouflage themselves like female. Okay, so what will the male sepia think? Oh, it is female, it will not do anything. So very cunningly, it will just go take those 2 tentacles inside, pretend as if it's a female, and it will go place its sperm into it. And the beauty of this story will not end here. The beauty of the Sepia lady is, it will decide. See, it will decide which sperm it should take. You are getting my point? It looks a little too much. Too much, yeah, I know. It looks a little too much, but that's how the story goes. So what you need to understand is, the lady Sepia has a take, has a call. Whoever manipulates the most, whoever tries to get cunningly close to her, she will try to take that sperm and she will try to reproduce. Now this is the story. Okay? Now, yeah, we'll skip this. These are all things you'll get it. See, and it's a creature which is active at night and spends most of its time on the sea floor. Okay, it will camouflage itself and whole day it is there lying, and night it will go and it will attack the other things. Okay, see, whenever, and it's also a beautiful statement I have taken here, a solitary species, except during mating. Sepia generally likes to be alone. Okay, it's a lonely creature. But when it has to mate, that's when it becomes close to other male friends. Okay. So, see, cuttlefish can change the color and texture of its skin within seconds, allowing it to camouflage with its environment and to communicate with other cuttlefish or predators. Special structures within its skin enables it to change color quickly. Okay, and see, one more very important thing, which we all know from our pharmacy knowledge. Whenever the cuttlefish feels threatened, what will it do? It will release that ink, and the entire area becomes dark or blue, whatever, and then it will immediately escape. Very quick creature, very quick creature. Okay, always moving, always in action, quick creature. Night it is very, very active. So these are few things you have about Sepia, and they say its eyes, which I showed you the picture, is very, very well developed. The vision of Sepia is very well developed. Okay. So this is about the fish, cuttlefish. So Dr. Hanneman, proves this fish, and trust me, once you start practicing, you will realize how beautiful and how important this remedy is. Our homeopathic clinics will be incomplete without this great remedy, beautiful remedy. Now, can we quickly understand how could Sepia be emotionally from the behavior of the cuttlefish? Okay, good. They are manipulative.
Desire solitude.
Okay, they like to be alone. Good. Second point. Desire solitude. They are very quick. Yes, good. They are very quick. See, that adapting, if somebody is trying to attack, within seconds it can change. So very quick. And indirectly you are missing something. You need to be very intelligent. You agree? If you have to be so quick, okay, if you have to be manipulative, all people who are manipulative are intelligent. They are using the intelligence in a wrong way. Manipulative and you are not caught. You are very intelligent. Done? Okay? So what you need to understand here is this fish likes to be alone. They like solitude. It's a very fast creature. It is a very active creature. Okay? And it doesn't care for its offsprings, meaning it's not a very, we'll try to understand a little later. Let me not give out all this now. So next few minutes we'll try to understand, can you see the image, and what is this image that is trying to tell us? Okay. So what I want to try to tell you is, see, this is a normal lady. This is, from the face, what you see is, she is a very indifferent lady. She is a normal lady. Fine, meaning if you see her expressions and if you see her expressions, they are different. So next 40 minutes, what I am trying to tell you here is how the transformation of Sepia from being a normal lady to an indifferent lady happens. Many times in our UG classes, we are told Sepia is indifferent. Sepia is not born indifferent. For Sepia to become indifferent, there will be a lot of reasons. Okay? So that is what we are trying to explore. And Sepia mind, we can speak for hours, 4 hours, 5 hours. That is the kind of information you have in your books. But as a teacher, I should know my limitation. When I am talking to a third year student, I should know where to limit. Just because I know 5 hours of Sepia mind, I cannot tell all that. Okay? So what we will try to do is, keeping the fact that I am teaching for a third year student, we will limit Sepia mind to your level. Okay? And wherever possible, I will try to bring in cases and we'll try making this as interactive and as interesting as possible. So my simple thing here is Sepia is not indifferent to start with. Okay? Sepia is like any other normal lady. But why is she going into indifference? What makes her go into indifference is a beautiful journey which we need to understand. Any clarification here? All of you are with me, you are trying to understand Sepia?
Yes, sir.
If you are lucky, if you are looking only at your exams, it's a dark picture. But I have told you, my classes are beyond exams. Done? It's a beautiful remedy. Please understand. Trust me, you will get so many women coming to a clinic and they will require Sepia. Okay? So to start with, you again have to interpret this image. What is this image? From? Yeah. Now how do you put this into homeopathic mind learning? Okay. A lady who is full of life becomes lifeless. A lady who was caring becomes indifferent. Okay. So this evolution of Sepia is very important. Sepia patient can come to you in this stage, or if you are lucky Sepia patient, you can get her in this stage. And you should know both these stages. We can't tell her you come back after a few years. Okay, because this is the Sepia I know. You can't tell that. Or we can't ask her to come back to this stage. She's already gone there. But our remedies are capable of bringing them from here to here. Beautiful. I just share a case. I suddenly realized a case, a very nice case. We had a lady, 15 days back she had come. She came and she had a lot of issues. Issues with her mother-in-law, issues with her husband. And she has wept so much in my clinic. Weeping, complaining about her mother-in-law, what she's going through and all those things. And how bad her husband is. It's been 4 years, they have not had any relationship. She's got a daughter, and because of the daughter she's staying in the house. All those things. I listened to her story very patiently. My assistant spends 2 hours with her, she takes the case and then she comes back to me. There are a lot of things that she can't share with the assistant and she shares it to me, and with a lot of confidentiality, we take everything in detail, all fine. And you give her a medicine, and next 15 days, 3 days back she was in my clinic, and she was very into and with a lot of energy. She just sat and she said, when I asked her, how are you? Doctor, just look at me how I am. I'm very fine. Hey, very fine, good. Doctor, I don't know how to tell. Last 3 weeks, a lot of things have changed. Yeah, what have changed? Please let me make a note. What have changed? What things have changed? Doctor, my relationship with my husband has become great. Okay? Fine? Same husband? Same way? Same way? Yeah, same way. I mean, last 3 weeks? Yeah. No. See, I am sharing the case with due respect to the patient. I have not taken the patient's name, identity has been taken care. I am sharing this to young homeopaths. I don't think she will also mind if I share her case with you, because I just want to try to tell you what a right homeopathic medicine can do. Okay. So in this situation, for example, this lady comes to you with so much of pain, so much of issues. How do you go about? As a third year student, what should be your approach? What comes to mind? What comes to mind? She's crying, she's narrating her issues. What comes to mind? Quick. Huh? Very good. You listen. Beautiful. Yeah. That's the first thumb rule. When somebody is trying to tell, please don't snub them. Don't cut them off. Cut them off means don't look at your watch. These are all the thumb rules. 99% I don't wear a watch. I am a very restless guy. Okay? So 99% I just don't wear. Even if I wear, I am very conscious. I don't look at the watch. What is that indication that you are giving to your patient? Time. My time is up or your time is up. So it's a very bad thing. Somebody nicely said, please listen. Good, beautiful, you listen. What next? Okay, good. So you look for something that you can prescribe. Yeah, I'm happy with the way you're going, coming up with answers. You listen, you look for something that is important for you, you make a note. Good. Agreed. Anything else? One at a time. I know. It's a very vibrant class. Full house, I appreciate, and that's why even I love coming to this class. Because there's a lot of energy. Like Sepia. Very active, very energetic, quick, good, beautiful. Anything else? Boys? Huh?
Reason for their action. If they have done something, why did they do that?
Okay, so why, what happened? Yeah, good. You keep, trying to elicit. Why, since when, what happened? How was your relationship before? Why did it go to this and now? Anything else you would like to?
Is she feeling better?
Okay, how do others feel about you? How is this important?
Because sudden changes they feel, they're shocked.
Okay, fine. So what others are feeling, fine, no problem. Okay, so evolution of miasm. You are all talking very technical. I am happy. Yes.
Are you feeling better after expressing?
Yes. Okay. Is she feeling better? Expressing about herself to you. Okay. Good.
What is her physical ailments?
What is her ailment that she has come to you with? Okay. Good. Yeah. I mean, it makes sense.
Her behavior when she is narrating the complaint, whether it is matching to what she is speaking.
Okay. Yeah. Go ahead.
Because some people can manipulate.
Okay. So because we are talking Sepia, your friend has become very conscious. Sir, is she manipulating? Okay. I mean, not she. With due respect to her. We are talking of a small case. Okay. Is the patient manipulating, or the weeping, okay, the sorrow, what she is coming up with, is it matching with the real problem? Is it less or is it more? Yeah, possible. Good. Beautiful. Anything else?
How did it change?
Huh?
How did it change? We can ask her like what?
Okay, what brought in this change? Okay, etc. See, okay. Now, one thing none of you spoke was, do you think she needs counseling? Okay. No, I mean, I only expected this answer, but unfortunately, we had many good answers, except this. So, should we send her to a psychiatrist, psychologist, or a counselor? Because she is down, she is depressed, she has been weeping non-stop.
No.
Okay. See, again, the thumb rule of homeopathy. If your remedy is right. If your remedy is right. Okay. Trust me, I did not do any counseling. I did not tell her anything. Okay. Done? So we just prescribe a remedy. And after you prescribe a remedy, the transformation, the magic. I mean, if you have seen Reproductive, there's some movie, this magic, there's some song. And 3 weeks she comes back happy and she says, sir, my relationship with husband has become, so good. We are like young lovers. He is messaging, we are chatting, stuff, this and all that stuff, So the entire environment changes. And what makes the environment change is your medicines. And as you start slowly getting into homeopathy very seriously, you see a lot of such things happening with you in your clinic. Patients experience beautiful things. It's a medicine which is closest to nature. And when you prescribe this, I really don't know, but myself, Professor Vijaykrishna always says it's a divine science. Somewhere in chronic diseases, if I'm right, the introduction for, there, Dr. Hanuman somewhere he uses the word divine science. Divine science. It's a beautiful science. And 3 weeks, she is so happy, it's a beautiful thing. So that's what I was trying to tell you. Homeopathy is the only system which can transfer things. Which can, now that lady, if we go back to the Sepia lady, what should be the follow-up? None of you asked me. You are all happy with the pictures. What should have been the follow-up? I did not share the husband's video. Okay, fine. What should be the follow-up of the husband in the video? He says, sir, there is a positive improvement in my wife's behavior. What is that positive improvement? She is no more talking of death. She has become more cheerful. She has become more happy. Did I counsel the lady? Did I see the lady? Sad thing. Did I speak to the lady? No. Only on what the husband told, I prescribed Sepia. The lady who wanted to die, who wanted to end herself, now she is happy. She is not talking of death. Husband is a very nice gentleman. Nice care is taken. Okay. And we could bring her back to life. You saw the images of the bedsore disappearing. Okay. So what I was trying to tell you is, this is the only system, and that's why I always keep telling, you students are blessed. You students are blessed to pick up this beautiful science. Okay? Fine. I hope I am targeting a particular group of students here. You are all blessed. So please follow the path. It's a beautiful science. Done? It can do wonders. So when you look at the evolution, I can again narrate a small situation. We had a neighbor, who was very lean, thin. She used to start her day at 6, doing all the household work. At 7:30 she would go to the school. She was a teacher. And 3:34 she comes back home. And 4 to 7:38 she takes music classes. And again 8 she does all the household work. And then again she goes back to sleep. Very thin lady, lean lady. So, one way of understanding homeopathic remedies is looking around. Okay. Now, this lady, I treated her with Sepia for some ailment. Now, what made me think of Sepia? She would also keep shouting, yelling at home and all those things. But what is that one thing that came to your mind as a third year student? Huh? She is a lady who is overworked, meaning from 6 to night 10:30 she has been non-stop working. So one very important thing of Sepia is women who are overloaded, who overwork. Okay? Women who are always busy, industrious women, overworked women, over stressed women is the first very important point. So what you see here is overworked housewife. Okay? Could be sepia. I don't say all overworked housewives are sepias. There's so many overworked housewives who enjoy doing the job. Okay? They can't be sepia. Right? So you are overworked, and sepia is a very, yes, very good. I like this speed. You know, when you are talking sepia, you should all be very fast. When I am talking bryonia, when I am talking gelsemium, when I am talking barreta, you should all be like barreta. Now we are talking sepia. Feel the sepia energy. You know, don't become sepia. You will not like sepia as I go with the evolution. But you know, that energy is very important. She quickly said, sepia women are very ambitious. They are very ambitious. Okay, hardworking, industrious, ambitious. They are independent. They are very active. Okay, independent, active. Women of today's generation. Okay, we'll discuss a little later. Now, if you look at the basic traits of sepia, they are very irritable. They are irritable and very restless. Things should happen very fast, impatient, restless, okay, and anxious. Right? Yeah, we saw that they are very impatient. And what is this? What is this image trying to tell us? They are confident. I told you, women of today, very positive women. They bring in a lot of aura. They bring in a lot of energy. Very positive. Okay? So this is the basic picture of sepia. Okay? So they are positive, done, and they also have a lot of fears. Sepia has got a lot of fears. Like for example, one very important thing is basically they're timid and they're money minded. Okay? I mean ambitious, materialistic. Money makes gives them a lot of comfort. Okay? And also sepia is a lady who is always cleaning. Many times we mistake sepia for arsenic. Okay? Because arsenic is also like this. Very fastidious. There is a rubric in your repertory, rest cannot. Till things are in its place. Things should be in its place. Otherwise they become very restless. Okay? Very fastidious, very clean, neat, and emotional. Okay? Emotional. When you look at the emotional side of sepia, you have something very important. What are all the emotional memories you can quickly recall? Pulsativa, very good. Ignitia, good. Natremure, okay. There are many more. For a third year student, we will limit to this. Now, how is pulsatilla when they are emotional? Okay, yeah, naturally. Pulsatilla can weep for the slightest reason. Small things. Drop of a hat is a proverb in English. Small things, you see pulsatilla weeping. As a homeopath, you should also understand, when you have a pulsatilla lady sitting in front of you, how you behave. When you have a natrum lady sitting in front of you, when you have ignitia, when you have sepia, you should know. What do I mean? Do I have a chair? Okay, fine, no problem. Like, for example, pulse, when they are weeping, they come dangerously close to you. I hope you understand the statement. Dangerously close, right? They come very close, and you see them weeping. You see them. You see the tears just falling. It is just free flow. It's falling, and they weep. And what you need to do? Okay. So if not with your hand, at least you have to be. You have to show at least that you care for her. Then you say it's fine, okay, I'm there, homeopathy is there, they've got beautiful remedies, I'll take care, blah blah blah. You tell something like, doctor, can you take care? Okay. Huh? She feels good, she feels nice. Whether you give medicines or not, that is secondary. At least that thought, that feeling that my physician is with me is a big thing for pulsatilla. When your netrums come into your clinic, the chair which is close to you is pulled back. They sit at a very safe distance. You will not do anything, but they sit at a very safe distance. And they are very, very careful. What are they careful about? When you are touching that emotion, they are very careful. Touching their emotion itself will take a lot of time. Okay? How is it in pulsatilla?
Very easy.
Easy. Okay? You have to just show you care. And pulsatilla is ready. Dupatta, kerchief, tissues, you see them weeping and fine. After 5-10 minutes, as if nothing happened, they're fine. Netrums, first of all, you touching the sensitive area is very difficult. Assume you are successful in touching that emotional area. She gets some confidence in you. Okay. What is the issue with netrum? The issue with netrum is one-to-one relationship. She wouldn't have told many things with your assistant. Okay? Or she wouldn't have told many things with you. She would have shared those things with the assistant. Must be she was more comfortable with the assistant. She shared. Assistant did a great job. She touched where she had to touch. And netrums will not openly cry like pulsatilla. Fine? And I have told you many times, you will be surprised, shocked that the theory of gravitational force in netrums will go against. What did I tell? The way they hold their tears. Okay? You will be of the opinion any second it might drop. But half an hour, 30 minutes, 20 minutes, they hold it. Okay? That is the capacity netrum has. And mind you, when you are dealing with netrum, when you are dealing with ignitia, when you are dealing with sepia, never console. Fine? Now this is what homeopathy teaches. See the beauty. Homeopathy tells whom to console, whom not to console. If you don't console a pulsatilla patient, what will the pulsatilla patient go out and tell? Yeah doctor. Everything should do. He is natural, That is what pulsatilla will feel. I am weeping so much, right? And he is sitting like a rock. Nobody should go to him. I will not refer any patient of mine. इसमें इंसानियत ही नहीं. Okay, so no, I mean, see, when you enjoy something, please also try to take back home some message. Tomorrow in your clinic, if it is pulse, please console. If it is netrum will have a line. And please don't dare crossing the line. Doctor, I am fine. Even if you pull your chair a little further, netrum will immediately tell, doctor, bite. You sit, I'm okay, I'm comfortable. Right? And that extra one tear, she just nicely, how was pulsatilla weeping? Pulsatilla, this kerchief, husband kerchief, or dupatta, and how dignified netrum will be, how beautifully netrum weeps, just take this and one extra tear which will be dancing, which will be in a hurry to come down, that tear she will nicely wipe it like this. I'm okay, doctor. I'm sorry. Who is telling sorry? Netrum. I'm sorry. I got a little emotional. Did you feel the emotion? Pulsatilla, you felt the emotion. But pulsatilla, did she say anything? Sorry, Giri, nothing? No. Because pulsatilla, weeping, consolation, ameliorates. And when ytterm by mistake, if you try to console them, they might start weeping. They might start weeping. So very important, you understand. Where are we? Very important you understand that which constitution, with whom, how you need to behave. Okay? With platina, when you have platina patient come into your clinic, don't act haughty. When I have a platina patient, I always am one step below them. Why I am one step below them? Only if I am one step below them, they will give me symptoms. If I act one step higher, they will not give me symptoms. So many times I tell them, sorry, please repeat, I did not understand. मेरा क्या जाएगा? Just me telling sorry, I did not understand will not make any difference to me. But when I am telling sorry, I don't understand, I have an intention. Fine, and then what will the plat tell? What will the plat tell? This guy does not anything. Fine, you will feel nice. His ego will go a little high. Fair. I mean, we are not judging anybody. Fine. So, you also have to understand how you act with Barretta, how you behave with Platt, how you behave with Lyco, fine? How you behave with Ophidia. Everything is what homeopathy teaches you. But for that you need to seriously get into homeopathy. Beautiful science. So, Sepia is again a weeping remedy, is an emotional remedy, but will not like consolation. Sepia does not like consolation, very important. See, moving ahead, there's a lot of anger. Naturally, a lady who is so overworked, please keep this in your mind. A lady who is overworked, okay, she goes into a lot of anger, frustration. When you go against her, when you go against your Sepia mother, she becomes more angry. Okay, from your experience, I should not go against her. Okay? So anger, contradiction shown. And they are also, what is this that I am trying to tell you? They are fault finding. Like arsenic, they are critical, they are fault finding. Okay? They are perfectionist. Critical, fault finding, and a lot of fears we have in Sepia. Okay, now what fears they have is, one very important fear, anyway all the three things are coming together. One very important fear is fear of poverty. You saw that a little while ago. Sepia is a money-minded constitution, ambitious constitution. They want money, right? And they have fear of poverty. One very important thing. And second thing is they have fear of wind, okay, and fear of ghost. Fear of ghost. Fear of poverty is what I want you to understand. Now the question is, will Sepia marry? Don't tell me no, or don't tell me yes. Please think. Please think. Okay, so one of your friends says, sir, she's a money-minded lady, she might marry a rich guy. Okay, chalo, what else? Huh? What? Meetings. Meeting, MA. Okay, fine. Okay. So, again going back to the Sepia fish. What did I tell? Sepia is alone, lonely creature, only for mating she needs people. Fine, okay. So you're beautifully applying the Sepia fish into the Sepia picture. Chalo. So now what you have to understand here is, what is the topic that we are trying to discuss? We are trying to discuss the evolution. Okay. So we started with a Sepia lady, right, who is ambitious, who is working and all those things. See, Sepia, generally, many Sepia women, marriage is not a priority. Many Sepia ladies, marriage is an obligation. Is my statement clear? I mean, they may not willingly like. Okay, or they might like. Don't take this question tomorrow. Did you marry willingly? Yes, I liked and I married willingly. Oh, then it is not Sepia. Please don't take my statements, these statements, very seriously and apply. What I am trying to tell you is, Sepia can marry, will marry. Fine. But majority of the times, Sepia's priorities will be different. They might tell, Mommy, 2 more years. 2 more years, Mommy, please. Why? No, I mean, I'll become the team leader. Okay. Or I'll be going to the US. Many girls have the same feeling. If you look at the present generation, that's what I told you. Girl of present generation. Fine. Okay. So what you also need to understand is, they will marry and they will also have a good sexual life. Done? Many boys during our era would not like a Sepia girl because there was a statement which we boys understood way back. Sepia has aversion to sex. Okay, I mean that was a very strong statement given in books. So what you need to understand here is, Sepia women will marry. Sepia women can also be active sexually. But what next? See, this is a story. This is an evolution. Please try to understand this is how patients will come to you. So what is happening now? She is a very hard-working female. She is a very ambitious female. She is working. Now she is also married. Please give your inputs now. So what is happening? What is happening? What is happening? The work. Yeah. They will not resign. They will not resign. Okay? Okay? They will not compromise. They are very independent women. They want a lot of freedom. Probably before marriage only she would have put a clause. What is the clause? I might marry you, right? But you can't restrict me. Restrict me from what? I want to work, I have an ambition. अभी बच्चे नहीं क्या 4 साल बच्चे नहीं. Done? They're very clear. Okay. So what generally happens here is, with this they feel the work pressure is increased and they feel what? Chained. They feel restricted. Okay. Now this is where the other phase of Sepia starts. Assume after 4 years, 3 years, even if they marry, okay, and majority of the times we have seen Sepia women telling, sir, majority of the infertility cases we have in our clinic, they are just very strong. What is that strong thing you have in Sepia is, they lack motherly instincts. Do you understand the meaning of this? What is this? They don't desire to become a mother. Fine? Now what could be the reason Sepia might be giving to you? One thing is her ambition, her work. And second thing, she would always tell you, sir, as a child, I don't have that attraction to kids. Okay? When some child is crying, there are so many girls here, and there might be so many boys here, who might just feel like taking the child, or something you do and you keep the child. And the Sepia lady will be feeling, how can they do all this? Chi? How can they do all this? No, I can't do. She'll be staying far and then she'll be observing. She can have that motherly instincts. That's what even the Sepia is, fish it is told. Once the kids are out, what do you say? It is not a creature which is taking care of its offsprings. We see many videos where the animals are so worried. It misses its younger ones and it goes hunting, searching, where is this, and all those things. If it is Sepia is going front, back, kids are not following, good riddles. Sepia will be going ahead. Okay? Don't take it in a very exaggerated way, but this is what Sepia feels. A motherly instincts Sepia will not have. And unfortunately, Sepia is more manly. What is it? Sepia is more mannish. Which are the other remedies we discussed? Carbons. You please use the word carbons. You have petroleum, you have graphites, natron here. Okay. Sepia, if you read Materia Medicas, I'll tell you about the physical appearance of Sepia after some time. When you are bored, when you want me to stop, please ask me to just raise your hand. I'll stop because it's going to be a little lengthy class. Please bear with me. If at all you feel you are hungry, you want to go out, you are free. Or you want me to stop, just give me a small indication. There are a lot of things to tell. Okay. Now, so they are the people who generally, see, they might be happy marrying. They might be okay with this also, but they may not be okay with this. There are so many women who might tell in advance, before marriage, मेरे को बच्चा नहीं चाहिए. क्या? मेरे को बच्चा नहीं चाहिए. Then कुछ भी कर ले बच्चा नहीं चाहिए. Right? So, I mean, definitely you need to ask why you don't want a child. That's also very important. Just because मेरे को बच्चा नहीं चाहिए, don't give सेपिया. सेपिया देने के बाद बच्चे नहीं आ जाएंगे. अल्लाह, सर सेपिया दिया, बच्चे आ गए, ऐसा नहीं होता. But what you have to understand is when a lady is telling she does not want to have kids, please do ask her why you don't want to have kids. Right? She might have her own reasons. Sir, बच्चे might be a big responsibility. मेरे को नहीं चाहिए responsibility. बच्चे might be a commitment. बच्चे will suffocate me. I may not grow in my career. Ambitious lady. The reasons might be many. As a homeopath, you need to understand what is the patient's reason and then you have to prescribe. Okay? So we'll go ahead and we'll also see slowly, see the beauty. What did I tell you initially? Sepia is very ambitious, very active and very quick, impatient, restless. Now with all this overwork, over pressure, fine, she is not able to handle things and slowly she is becoming sluggish. She is becoming slow. This is the psychosis that will set in Sepia. This is the evolution that we are trying to understand, and slowly, slowness, sluggishness will start setting in. Okay, slowness, dullness. A lady who had good memory will start losing memory. Memory becomes big. Okay, and there are issues. Slowly, what happens is they start losing ambition. Ambition loss of. A lady who wanted to do something big slowly starts losing. And you can also see that business magnate, fine, now slowly starts having an aversion to business. She doesn't feel like doing business. Okay, and you all know that she likes to be alone, wants to be alone. She doesn't like any company. Like we saw Sepia. What was the statement I gave? It is a solitary fish. Good. It is a solitary fish. It wants to be alone. So aversion to company, aversion to people, and this is the stage. This is the stage when slowly indifference will set in. You are clear? This is where a lady who was caring, who was loving, who was affectionate, okay, with work, with pressure, she transforms into an indifferent lady. Indifference to family, indifference to friends, indifference to people, indifference to our own children. Okay, we get people like this, okay, in clinics. So sir, before I was not like this, sir. I used to like my child. I used to hug her, I used to kiss her. Now, I don't like her presence. I feel angry about her. I hit her. Sepia. Right? So this is the evolution. And slowly, what you also see is they are loathing of life. Okay? They are loathing of life. No interest in life. To the extent, I'll share a beautiful case here. To the extent, I shared this case. We had a lady who had consumed some 30-40 tablets, and she was rushed to a emergency ward, and they did stomach wash and all those things. Now what should, and she was brought to me after all this happened. So what should be your question? Why? Why tablets? Why not something else? Okay, why did you decide to end your life? Sir, I have so many problems. She had bad skin issues. I have so many problems, and I thought it's better I die than living with all these problems. Okay, so now what is the rubric? See, is it death desires? What is she already done? She has attempted. So there is a rubric. Suicidal disposition from her miserable existence. Beautiful. Please have this symptom rubric in your mind. I have solved many cases. I'll repeat this rubric. What is the rubric? Suicidal disposition from her miserable existence. My existence is miserable. I am suffering so much. It's better instead of suffering so much, let me end my life. Okay. And that lady, she's so beautifully improves. And the beauty of our patients. What is the beauty? When they improve, at least in India, they spread, they tell. And minimum I should have had some 30-40 references from this particular lady. Now that's the big thing of our patients. They don't keep it to themselves. They're not selfish. They spread. And that's how, homeopathy is flourishing. People see results, they spread. And it's a beautiful and a very reliable source of advertisement. You go on TV, you come on a newspaper, you come on YouTube, you can fool few. Fine? Okay? Or only few might get attracted towards you. But when you show results and when patients tell to their people, that will have a better impact. Sir, instead of living like this, let me die. When you get somebody like this, I have 30-40 cases. I've abused this rubric with beautiful results. They come back. I don't feel, sir. I make it a point, I ask them, sir, last visit you told you didn't want to live. No, now I don't feel. No, it's not like that. And many times after 2-3 sitting, if you ask the patient, they tell, did I tell? Did I tell me? Did I tell? To that extent, they get back. And trust me, possible only with homeopathy. Yeah? Okay? So, any quick questions? Do you want a small break of 5 minutes? 2 minutes? Huh? You want? No? Yes? No? Okay, now, okay, we'll decide about the break a little later. Now I want you to tell what you have understood. What did we discuss last 40 minutes? We spoke of mind in a very concise way. This is not end of Sepia, this is the beginning of Sepia. I am just giving you the symptoms, I am just creating an interest in you so that you go back and you refer books and you try to collect more and more information about Sepia. Okay? So what did you understand? To start with, Sepia is very affectionate, very caring, loving lady, Indifference in Sepia comes in a later stage. And there are a lot of reasons why she goes into indifference. This is the catch of today's class. Okay? Because many times we have affectionate ladies come into our clinic and we homeopaths, we give some other remedy. Okay? Because we have a strong notion that if it is Sepia, then she has to be indifferent. That comes up a little later. I also had a very nice case of, what is it called? Hot water conversions. Hot water epilepsy. Now the beauty of this case, unfortunately she did not find results in allopathy and then she came to me. Whenever she pours hot water, when she takes bath with hot water, she throws a conversion. Okay, hot water epilepsy. And we were trying to understand this case and this lady was trying to tell, sir, not much towards kids. She's got 2 grown-up girls. When kids have fever at night, as a mother, what do? Will you get up, you are anxious, you take care and all that. She is a lady who says, no sir, I'm not bothered. sleep. I sleep the way I usually sleep. I don't have that kind of feeling. My husband, see the beauty of the nature. Husband, he gets up, he takes care, but not because he is taking care. See, even if he is taking care as a mother, I don't think you should get good sleep. I am not gender biased. But as a mother, you will generally not get good sleep. Fine? But she is very comfortable, she sleeps. Lot of other things were taken into consideration and she was given Sepia. Today, how much ever hot water she pours on her head, she does not get epilepsy. Then, so these are all the entry points. How in my clinic I have used Sepia. Okay. So what we saw is they are very ambitious, independent. They are very feminist. Which was the other feminist Ignitia. They are very feminist. Sepia. They are very mannish. Okay. Probably the testosterone in them will be more. And the estrogen and the female hormones might be on a lower side. They are more mannish, okay, and slowly you see a lot of fears, slowness coming in, and indifference, loathing of life, suicidal thoughts. This is how the journey goes. Okay. Any quick questions in Sepia? We also saw that they are emotional. Okay, they can weep, but weeping, consolation occurs. Any quick questions? Okay, start ಮಾಡೋಣ. Yeah. Okay. See, we'll continue from where we had stopped. So last, if you remember, this was the last slide of Sepia. One quick 2-3 minutes, we'll try to recall Sepia, what we have understood, and then we'll continue with Sepia. Okay. So what did you understand in Sepia? Okay. Okay. Yeah, one second. When we ask a question, in general it will become very difficult. So what we saw was Sepia, it is mainly prepared from the cuttlefish. And as I also tried to explain a little behavior of cuttlefish, how it is a solitary creature, okay, and it has a very nice character of camouflage. They can camouflage. We'll strictly get back and see what I was trying to tell you is, this is where I stopped. Loathing of life, and I also shared a case where we had given her Sepia based on the rubric. What was that rubric? This is the key point. Okay, and in that case of bed sores, I had taken despair, okay, from her miserable existence. She was hopeless and she was despair of her miserable existence. That was the rubric taken in the first case of bed sores. Okay, and then that offensive discharge, bed sores itself, we have Sepia. And you saw how Sepia cured the lady, both of her bed sores and her thoughts of death. Okay, so we will we'll quickly look at the other aspects of Sepia. Sepia is not only the mentals. Sepia is not only the emotional picture. We also have a physical picture of Sepia. Okay, so if you read books, they say washerwoman's remedy. Okay, I mean, it can also be a viva question for you. Name the washerwoman remedy. So the remedy is Sepia. Now why Sepia is called washerwoman's remedy? Okay, many of the complaints you see now, that's what we are trying to understand. We look at the ailments of Sepia. The ailments can be emotional and the ailments can be physical. So we look at both physical and emotional ailments of Sepia. Okay. So one thing I already told you that laundry work. Okay. Like for example, washing clothes, being in cold, ironing, these things can aggravate complaints in Sepia. Okay, and Sepia has a huge list. Ailments from anger, ailments from suppressed anger, ailments from vexation, and it's also an injury remedy. We will look at the sphere of action next, and you will understand it has a very good affinity for the connective tissue. So you see all these things coming up here. Ailments from blows, injury, overlifting, falls, jar, getting wet. And this is what I just mentioned, laundry work. And boiled milk. Milk is something Sepia will not like. Boiled milk will cause diarrhea in Sepia. Okay? Boiled milk, and you also have fat, pork, tobacco. Fat, pork and tobacco. Okay? Again, I would like to share a small case here. This was a case of a very young man who was my patient from a very small age, and he had come to me for wisdom tooth. There was this wisdom tooth, and it was impacted. The X-ray, the wisdom tooth was like this, and he wanted me to give homeopathic medicine, and he wanted his tooth to become like this. Okay, you getting my point? The X-ray shows like this, and the dentist says absolutely no scope for medicines, and this gentleman wanted me to try. I told the boss, nothing can be done. How? Yeah, I know. I know, seriously. So don't take up every case. We have our own limitation. Fine, and this is one such case. It was literally like this. Horizontal, he wanted to give some medicines, and and make it vertical, which was not possible. I explained. And he went for a small surgical procedure, and they had to extract. And in the bargain, they also gave him a lot of antibiotics. And then he comes back with a bad allergy. Okay? And that's when he started blasting me. I told you, you take up the case, you give medicines, now you send there, see my state. And from Chennai, he took a flight, and he came and he met me with a very acute and a bad state. Now why I am trying to tell you here this particular situation is, generally when we talk of drug abuse, what remedies come to mind? We many times think of Naxvamika. The common remedy, bad effects of allopathic drugs. Bad effects of allopathic drugs. There are some 18 to 20 remedies mentioned in our repertory. I want to bring it to your notice. It is not only Naxvamika, it is not only aloes, it is not only pulsatilla, carbovage, sulfur, you also have sepia there. Okay, so drug abuse, bad effects of allopathic drugs. Based on a small totality way back, I don't remember, I had given him sepia, and he beautifully improves. His allergic reactions will go down from head to toe. So sepia can also be a very important remedy for bad effects of allopathic drugs. That's the catch. Suppressed emotions, overwork, which you already know, that's what we started with. A over exerted housewife, a overloaded with work. They are the women who can go into sepia state. Okay, overwork, loss of fluids, sexual excess. Loss of fluids, sexual excess. Any quick clarification, if at all you have anything to discuss here in sepia? See, milk, there are a lot of remedies. We spoke of few. Yeah, very good. We spoke of natrum carb. We also have ethusa. Okay. Do remember sepia. Now, what is the difference between ethusa, natrum carb and sepia is, they have issues after drinking boiled milk. Okay. Done? Boiled milk, and they will end up with diarrhea. Very important. Okay. So, we will quickly look at the physical appearance. See, one word I told you, when I spoke of sepia mind, sepia women will be more mannish. Can somebody quickly describe or quickly think of what could be the physical appearance of sepia? Okay. Broad shoulders, flat chest. Okay. I hope you are getting this picture. Try to imagine this picture. They generally have flat chest, broad shoulder, and somebody used the word narrow pelvis. Narrow pelvis. Okay. And women who have butterfly-like discoloration over the cheek. Very important. Butterfly-like discoloration over cheek. In your gynec books, it is given as chiasma. Chiasma. Okay, that is different. Chiasma. Okay. So you will have that butterfly-like discoloration over the cheek. Chiasma. Okay. And suited for girls, mainly predominantly a female remedy. Not that you don't have male sepia. You can have male pulsatilla. Okay. But what I meant there was predominantly pulsatilla is female. You can also have a pulsatilla male sitting in front of you and weeping. And what is that thought you get? This guy is weeping like a woman. And we have people coming to us and weeping like children. They are weeping like children. You have rubric in a repertory. Weeps like children. Okay. So predominantly sepia is a female remedy, narrow pelvis, flat chest. Okay. No curves. If you want to make it more simple, done. And generally they also have rigid fibers. Now what you have to remember here is that softness will be missing, so they will be more firm. The muscle fibers will be more firm, more hard. That is sepia physical appearance. Okay. One beautiful point I have taken from Dr. Phatak and even Dr. Allen's keynotes, pot-bellied mothers. It's a beautiful symptom. What is this? Pot-bellied. I told you about all being flat. Okay. But a sepia mother can have pot-bellied mothers. Okay. So, who are disposed to sexual excitement or overload by sexual excess, weak, lean, thin and debilitated. Now, we spoke of two things in the afternoon. One was that ailments from, and second thing we saw was how do they look physically, the physical constitution. Okay, we'll quickly look at the sphere of action. Where do you see sepia acting? Any wild guess? Okay, genitalia, very good. Predominantly female genitalia, very good. First point. Second, skin. It's a beautiful remedy for skin affections. We'll explore skin. Then, J, yes. Renal, kidneys. Okay. So, when you look at the broader headings, I have taken this from Dr. Bird's Physiological Materia Medica. Venous system. It will cause sluggishness. It will cause stasis. Venous stasis. Okay. So what you see is venous congestion, portal hypertension. These are few things that can happen in sepia, venous system. Because of portal hypertension, because of sluggish liver, there can be a lot of issues. Digestion can be affected. Okay, so few things you'll have to remember. Now, second very important thing, as somebody rightly said, a remedy acting on the female genitalia. Okay, and to make it simple, ovaries. Remedy affecting the ovaries. One of the beautiful remedy for polycystic ovarian disease. Can somebody quickly tell me why sepia could be a probable remedy for PCOD? Very good. PCOD, PCOS is a beautiful remedy. I am not trying to tell you all cases of PCOD you have to give sepia. It's a very wrong statement. Okay. But if you look at the mind of sepia, there are ambitious girls, there are girls who have more of testosterone, girls who are more of feminist, girls who want more of independence. Okay, fine. Girls who want more of freedom. They are the girls who will end up with PCOD. Okay, and sepia, if indicated, I repeat, if indicated, can be a beautiful remedy for PCOD. Okay, so ovaries malaction is there, ovarian atony, scanty menses, done. Very important is uterus. Okay, as a third year student, as a gynec student, what do you expect the action of sepia on uterus? Why prolapse? Why prolapse? Something we are missing here. Okay, yes, very good, there is weakness, but why basically? It mainly affects the connective tissue. Okay, the tissues, the ligaments which are giving support to the uterus, they go into weakness. They go into relaxation. So what you generally expect in sepia is there will be prolapse. Relaxation of the connective tissues. The ligaments, the tendons, they become flaccid, they become loose, they become relaxed, and then there will be prolapse. Very important. And one of the beautiful remedies for uterine prolapse. Okay, you know that. You would have studied in a therapeutics. Very important remedy for uterine prolapse. Okay, what is the specialty of sepia in uterine prolapse? So a lady will have that organ sensation. What is that feeling? A bearing down sensation. Feels everything is coming out through her vaginal opening. So what will she immediately do? She has to cross her legs. Many times they have to cross her legs assuming things will come out and she has to prevent herself, and they cross their legs. So uterine prolapse, very important. And again a beautiful remedy for leukorrhea. Pelvic inflammatory diseases, you would have studied in gynec. PIDs, very important remedy. Okay, leukorrhea, ulceration, prolapse, and you are talking of GI. Somebody was talking of GI. Okay, now GI action is mainly because of portal congestion. The liver gets affected, and naturally there will be indigestion, there will be hemorrhoids, okay, and there can be constipation. Indigestion, portal congestion, constipation. These are few things you have in GI. Okay, and liver, very important. We saw that portal congestion will be there, hepatitis, and one of your friend was talking of kidneys, its action on kidneys. So here acting on kidneys, you see, it has a capacity to produce stones. Okay, so scanty urination, urine gets concentrated, urine can become sedimentous, and then there can be renal stones. Better remedies for stones? Berberis, we have discussed. Lycopodium, benzoic acid, good. Yes, Lycopodium dubara. Okay, chalo. Lycopodium pulsatilla. Sarsaparilla, good, it's there, good. Okay, Cantharis. Now when do you think of Cantharis in... Okay, see, you are telling me the UTI symptoms of Cantharis. But do remember, Cantharis, according to Dr. Clark, if I remember, in a small book, the prescriber, he says, when the stone is passing, okay, from the ureter towards the bladder, that produces enormous pain. He says, to relieve the pain, he says, you can think of Cantharis. I am clear? Okay? Okay. So, kidney stones, see, this is a beautiful area. Skin. And if you read your source books, you have plenty of symptoms mentioned under skin of sepia. It can be tinea, it can be herpes, okay, pellagra, quiasma, eczema, yellow discoloration. Yellow discoloration. Any of these things are possible with sepia. Okay. So before we go to the next heading, what did we discuss? One, ailments from, hope ailments from is clear. Second, we spoke of the physical appearance. How do they look? How do they look? They look lean, thin, okay, flat chest, narrow pelvis, broad shoulders, rigid fibers. Or ultimately you are getting a feeling of seeing a man, okay, dark complexion, and you have that yellow discoloration over the cheek, okay. This is the typical appearance, okay. Sphere of action, you saw majorly all the organs getting covered. It's a polycrest remedy, it's a deep acting anti-miasmatic remedy. So head to toe, you see everywhere Sepia acting. I just give a list of predominant action of Sepia. Okay? All clear? Okay. Now the next very important thing here is, we will look at the characteristic symptoms and then we will stop. Okay. Now before I take up the characteristic symptoms, we have a few more headings that we need to understand. That if you look at the thermos, okay, Sepia is a chilly patient. They cannot tolerate cold. They want to be warm. Chilly patient, first point. And second thing is, when you look at the miasm, you see all the three miasms. But predominantly you have more of psychosyphilitic. You have more of psychosyphilitic miasm. All the three, but more of psychosis and more of syphilis. Done? Now we look at the characteristic symptoms. Okay. See, I may not typically go as per the list, but first thing is, when you look at the side affinity, you know lycopodium. Yes. You know chelidonium. Right side. You know apis mellifica. Right. So when we say a specific side, we have few remedies immediately coming into our mind. Okay. So similarly, Sepia is more left-sided. Okay. See, it's a polycrest. You can also see right-sided affections in Sepia. I don't deny. But I am using a word with caution, and that word is predominantly. So predominantly you see many affections of Sepia coming on the left-hand side. Okay. Now second thing here is, see, this is a very important sensation. Sensation of ball. Which remedy comes to mind? Huh? Where do you have sensation of ball in acasis? Bladder. Okay. Ignitia. So ignitia will have a sensation of ball in the throat. Okay. Cannabis. Asafoetida. Okay, good. So Sepia also has a sensation. Sensation of ball in the inner parts. Sensation of ball in the inner parts. This sensation of ball is mainly seen during menses, pregnancy, or during lactation. With constipation, diarrhea, hemorrhoids, leukorrhea, and with all other uterine complaints, they have this sensation of ball in the inner parts. Okay. So second thing is, see, this is a remedy which has an affinity to faint. Fainting. Okay. They just faint. And if you remember the case I just spoke of, vocal cord polyp. One important symptom that we took was, he faints at the sight of blood. Okay, when he sees blood, he faints. But this gentleman would give blood donation very regularly. But the only condition was, he would not look at blood. There were his friends who would assist him. He would not look at blood. The moment he looks at his blood or any blood, he will faint. Okay. So fainting at the sight of blood, you have a rubric. Done? Now each remedies can faint because of a different reason. Somebody might faint smelling flour, idiosyncratic hypersensitive people. Somebody can faint in the sun. A lot of reasons. We will try to understand why Sepia faints. What is the reason behind Sepia fainting? Okay. So the reason here is, they faint easily. Yes, it is there after getting wet from extremes of heat or cold. Both the extremes. If the weather is very hot, they can faint. If the weather is very cold, they can also faint. Okay? And riding in a carriage. Now this is one very important symptom while kneeling at church. All these remedies were poured abroad. So when somebody has to kneel down in the church, which is a part of the custom, when they pray, when they are kneeling down in the church, they faint. Okay? So that is sepia again. So yellowness, we saw this very, very prominent. Many areas you see yellowness. What is that yellowness we were discussing about? We saw yellowness over the cheek. Okay. Plasma. You also have conjunctiva becoming yellow. You also saw, what is the quick interpretation? We saw sepia acting on liver. Okay. So face, conjunctiva, yellow spots on the chest, yellow saddle across the upper part of the cheeks and nose. See, so beautifully Dr. Allen, he writes in his keynote, a telltale phase of uterine ailments. What is this? Telltale phase means it is an indication. See, what is happening inside, you are getting to know on the face. Okay? It is an indication that something is going wrong within. So that plasma is very important for you in sepia. Okay. Now constipation. Again, see now why constipation? Please think, use your physiology, use your pathology. There is mainly total congestion. So it will cause stasis of the rectal veins. That's where you will also have hemorrhoids. And that's why you also have constipation. Stools very hard, knotty in balls, insufficient, difficult, pain in rectum during and long after stool. So what do you understand by this? When he is passing stools, he has pain. He has passed in the morning at 7 a.m. but pain continues till 12, 1, 2, 3, that's what it means. Pain during and long after stool. Okay? The other remedies is nitric acid and sulfur. Sense of weight or ball in anus, not better by stool. Where did this ball come up? I told you in sepia there is sensation of ball in the inner parts. So rectumally mainly they have the sensation of ball. Ignitia sensation of ball mainly in the throat. Sepia sensation of ball mainly in the rectum. Okay. Now again, a very valid point, which is often referred, confirmed in our clinic, is beautiful remedy for bedwetting. Beautiful remedy for bedwetting. Any quick remedies for bedwetting? Creosote, good. Equisetum, very good, agreed, good. Creosote, equisetum. Any other remedies? Bedwetting. Okay. See, berberis is a remedy acting on the kidneys. And mainly berberis, you all know, it causes stone. It causes and it cures stones, kidney stones. But the question here is bedwetting. Benzoic acid. Now, when do you think of benzoic acid? Yeah, very offensive. When the urine is very offensive. Benzoic acid. Okay. The entire room stinks. Benzoic acid. Okay. When do you think of creosote? See, creosote is again very offensive. Urine will be very, very offensive. What is it? Urine, he passes urine better only on lying down. Okay. Then? Yeah, that's what I wanted. He dreams as if he is passing urine and in the bed he would have passed urine. That is creosote. The repertoire gives many more remedies. As a third year student, you should remember. Trust me, and I sometimes wonder from where did our stalwarts get the symptoms. It's shocking. Patients come and tell the same way. We had a lady, elderly lady, and it was very embarrassing for her. You know why it was embarrassing? She had the issue of bedwetting. And she told, sir, I really don't understand. I feel I am passing in my bathroom. I feel I am passing in my bathroom and I would have passed here. What is that feeling that you are passing in bathroom? She would dream as if she is urinating in the inner bathroom and she would have passed urine on her bed in sleep. Very embarrassing situation for a 72 years old lady. Fine? Okay? So, urine involuntary, dreams passing while something, you have a rubric like that. 8 to 10 remedies are there. Your search will become very simple. Out of those 8 to 10 remedies, see how the lady is, look into her disposition and give her one remedy. Things will become very easy. Okay? So creosote has dreams of urination. This is a very famous symptom we just discussed. And what was that symptom? The connective tissues of the uterine or the supporting tissues of the uterus, they become lax, they become weak, and then there is a possibility of uterine prolapse. Okay, and the lady will cross her limbs. You know this, so I will skip this. What did I tell you when I told you about sepia fish? It is a very active fish, always in movement. You have one very peculiar symptom in sepia, and what is that symptom is? Difficulty in breathing, asthma, aggravation lying down, asthma better by dancing. I'll repeat, asthma better by dancing. That is what you have in sepia. Asthma better by dancing, okay? Dyspnea, aggravation sitting after sleep, in room, amelioration, dancing or rapid movement, walking. See, naturally when you have difficulty in breathing, you don't feel like walking. In sepia they can't sit, they have to walk. If they walk, they feel better. That is the peculiarities of sepia. Okay? So we look at few more peculiarities, 3 or 4 more peculiarities, and then we'll stop. Symptoms which will come every 28 days, meaning every month you have symptoms coming up. Periodicity, headache coming up every 28 days, pain in back coming every 28 days. Okay, that is what we call it as periodicity. Okay. See, there are few desires. What generally a sepia lady likes is, she likes sweets, chocolates, vinegar, sour things, bread, salt and stimulants. These are the likings of sepia. And what she does not like is, she will not like fat and salt. She will not like fat and salt. Yeah, I mean it's possible. There are many remedies, which will have both. Okay. See now, how do you explain this? We have seen in few patients, sir, I used to like salt. Now I don't like. It is possible. See, while proving it is done on different individuals. Some might have an aversion or some might have a desire. Or it could be that miasmatic change. During Sora, they might like something, or during psychosis, they may not like something. It is possible. It is possible. Okay? Now, very important for you in sepia. As a female remedy, you have n number of symptoms mentioned under female. One last thing you have here is abortion during 5th or 7th month. So you don't see abortions in sepia in the early days. You will see abortions mainly during 5th or 7th month. 5th or 7th month. Okay? 5th or 7th month. And very good remedy for hair fall. We had a case yesterday. A young girl doing her MBA, she has got bad hair fall. And she was there in our clinic yesterday. And she is very clear that her hair fall started after she got fever. She had bad fever, and after fever she's almost lost some 50% of the volume of the hair. Okay. So how do you interpret this? No. Yeah, ailments after acute exhausting illness. I have shared a remedy. Very good. I am happy you could remember. Carbovage. Okay, ailments after acute exhausting disease. Carbovage. Okay, so think of carbovage. See, why I am trying to tell you that case here is, not every case of hair fall you can think of carbovage. Carbovage has its own indication. Now sepia has its own indication in hair fall. Hair fall after chronic headaches at menopause. Hair fall after chronic headaches during menopause. That is sepia. Very good remedy for menopausal complaints. Okay. Probably the last symptom, see the beauty of the symptom. I don't know from where they get, how they get, but see how it is. So nicely mentioned. What is it? Motion of fetus is intolerable. Can somebody quickly comment on this statement? Can somebody quickly comment on this statement? You understand the importance? You would have seen movies, you would have seen your sister, you would have seen your aunt, uncle, whatever. Okay. The moment the child, the fetus inside kicks, the mother gets excited. She'll be calling her husband also. Or if she's already has got one more son or a daughter, she'll be calling, see, your sister or brother is kicking. Feel it. So this is something which is exciting for a mother. She feels happy. Fine. And what will Sepia feel? Sorry. What will Sepia feel? Sepia is a very indifferent lady. Okay. And what was the statement I gave you? A lady who lacks motherly instinct. Fine? A husband, emotional husband might ask, is some movement happening? Fine? She might take it in another way and see, basically she does not want it done, and when something you don't want it is happening, you will not like it. It's as simple as that. Fine? A lady who does not have motherly instinct, she carries and she is not enjoying. She will be just thinking when this boy will come out. Bus. Fine? So this is very important. There's another remedy. Which is, see, here she is intolerable. Remember, in clinic future you will have issues. There is one more lady, she feels very sore. Good, but before explanation she gave the answer. Okay, very good. So you have other situation happening in clinic that the mother is very sensitive. Doctor, it hurts. Doctor, it pains. Not that she does not have motherly instincts. Not that she does not want to enjoy the fetal movement. But her entire abdominal wall, her uterus, everything will be sore. When the baby kicks, when the baby moves, okay? Here she is saying, that's a different remedy. And here, why are you kicking? You come out, I see. I will kick you. He has a feeling what Sepia mother will have. Done? So the remedy rightly told by your friend is arnica. Sensitive to fetal movement. See the English. Sensitive to fetal movement is arnica. Fetal movement is intolerable. I cannot tolerate this. What is this nuisance, nonsense? He kicking me, I cannot tolerate. Is Sepia. Done? So to sum up, we spoke of ailments from physical appearance, thermals, miasm, side affinity, pathogenesis, and of course the characteristic symptoms. Any questions? No, all fine? Chalo, if you are clear, thank you. Thanks.